It is important that your baby stays warm but not too warm. A term infant needs to be dressed in 2 layers. An example of this would be a sleeper and a sleep sack. This is 1 layer more than what you wear. Do not put a hat on your baby while inside, especially while sleeping, as this could cause a risk for suffocation if it slips over the face. You will need a home thermometer, preferably an oral digital or under-the-tongue thermometer. You will take your baby's temperature under the arm. For term babies, a sleep environment of 68 to 72 degrees Fahrenheit is recommended. Normal infant temperature is 97.5 to 99 degrees Fahrenheit. Plan the first bath after the first pediatrician appointment. Take your newborn's temperature at least once a day until you see your pediatrician. Keep your baby warm at the pediatrician's office. Bring a warm blanket or do kangaroo care in the office. Kangaroo care after baths to help baby warm up. Remove swaddling when your baby is ready to roll. Due to their size and immaturity, preemies typically need to be dressed in more layers than term babies. The NICU will instruct you on how your baby needs to be dressed at home. Here are some tips for keeping your preemie warm. Dress your preemie in the layers they wore in the NICU. Avoid drafts in exterior walls. Do not bathe your preemie until after the first pediatrician appointment. Keep your preemie warm and they should continue to eat well and continue to gain weight after discharge. Cold babies do not eat well. If your baby is not eating well, check their temperature. Here is how to take your preemie's temperature. Use an oral digital thermometer. The normal temperature is 97.5 to 99 degrees Fahrenheit. Check under both arms if you are getting a temperature below 97.5. Supporting your baby's temperature. If your baby is cold, why? Is the room too cold? Is the baby wet? Did they pee out their diaper? Fix the problem by warming up the room, changing the clothes in the diaper. Provide kangaroo care for 1 hour. Recheck the temperature after kangaroo care. If you are having trouble keeping your baby warm, call your pediatrician. If your baby is hot, why? Are they overdressed? Is the room too hot? Fix the problem by removing clothing layers. Recheck the temperature in 30 minutes. If your hot baby's temperature does not come down, your baby may have a fever. Most babies have other symptoms of illness with a fever, like poor feeding and excessive sleepiness. If your baby is showing these signs or you are unsure, call your pediatrician. Remember that the pediatrician office will be cold and your baby will be undressed. You can ask the office to warm the exam room up for your baby. You can also ask to make sure that the office takes your baby's temperature before your baby is undressed, weighed, and examined. Prepare by bringing a warm blanket and covering your baby or provide kangaroo care during the visit. If your baby was born during the cold months of the year, warm up your car before putting your baby in it. All of these tips will help avoid any issues with your baby's temperature at home.